Now that we've put Checker's bandage on, it's a good time to give him his antibiotics. He's on oral antibiotics. He's on trimethoprim sulfa twice a day. And so it's a good time to demonstrate how to give oral antibiotics to a horse. Now, he's getting 12 pills twice a day. Of course, I can't just ask him to swallow them. So what I'm going to do is I'm going to dissolve them. Trimethoprim sulfa is a really easy dissolving antibiotic, so I don't have to plan very far ahead. I'm going to put these pills, hopefully I can just put them down here in this catheter-tipped syringe. I love using catheter-tipped syringes for dosing. They're relatively inexpensive. You can get a new one for each patient or when it wears out, and it's not too heartbreaking when when you lose it or it gets broken. I'll put some warm water in. They all dissolve a little bit better in warm water. And just put my plunger in, try to avoid squirting myself or squirting my patient. Dissolve it.
Or your tech.
That's right, or my tech. Get it dissolved a little bit more, make sure I got it nice and dissolved. Now there's a reason why we always choose Checkers for our patient, because I'm counting on him being good. Giving oral medication is a great way to end up wearing medicine. All right, Checkers, are you ready for your antibiotics today? Okay.
Now, as Barbara and Laura both stand back, not directly in front of the horse. She's introducing it through the gap, the dental space there, so that she can get over his tongue and gets it squirted back in his mouth a bit, not all the way back. She doesn't have to worry about getting way, way back. Holds his head up a bit, asks him to swallow. Notice he's holding some in his mouth. He's letting some drip out. You always sort of take that into account when you're figuring how much dosage or how many pills you're going to be using here. You figure they're going to lose some. They don't swallow it all down.
But that was good. Basically he's a good patient. Yes, I've lost perhaps 1 pill's worth, but I counted that into my dose. And let's look at some of the other things we can do with other forms of oral medication and some other ways to persuade them to take it. Let's finish talking about giving pills in an oral fashion or dissolving pills and how to best administer antibiotics or anything that comes in a pill form. Lots and lots of your clients like to use different flavorings when they give their horse oral antibiotics. And I think your choices are limited by what you can find on the supermarket shelf. You'll have people who swear by molasses. Personally, I find molasses to be sticky and difficult to work with, but other people really like them.
They can make a mess.
That's right. Applesauce is also very popular, and horses do like the taste of applesauce, and it's good for disguising some stronger, more bitter flavors. There are lots of people that just like bulk Kool-Aid mix, soft drink mix, and certainly you can use that along with your hot water and your pills and your dosing syringe.
I think foals often like that flavor. I've found that they kind of think that that's kind of cool, just like children do.
And then there's a whole group of people that really like Jell-O in all of its forms, either just dissolved as an intense sweetening flavoring mixture, or actually allowed to partially set up so that you've got some body in your syringe. If you've got a really wise horse that lets the liquid dribble out the corners of their mouth, you can actually let the Jell-O set up a little bit and squirt it in there and hope to have it stay in a little bit better. One of the other little tips that your employer and your clients will love you for is right after you use your dosing syringe, your catheter tip syringe, if you wash it and clean it up, it's going to last that much longer. I mean, if you leave it set up there with that gummy stuff in there, you'll pop the rubber stopper off the very next time you go to use it, and it just adds to the expense of the day. Other things that we give orally, there are lots of things. It's amazing how it's changed in terms of how much we give orally.
Oh, absolutely.
So this is a pre-prepared syringe of antibiotics used in the treatment of equine protozoal myelitis. It comes all made up. Now the important part with this sort of thing is to look at the calibration. You can see this is calibrated by pounds. The calibration starts up at this end. So, 100-pound horse, 200-pound horse, 300-pound horse. And so you're moving your ring in association with how much your patient weighs. You're not measuring from this end, you're measuring from this end.
Right, from that end to that part of the roller.
Right. Now, lots of your clients are going to be accustomed to using paste wormers, and everybody has their little calibration ring set up just a little bit differently. The locking mechanism, probably the most important thing to remember is to lock the lock. So when I get it to a calibration point, I need to move it to lock the lock. Otherwise, I'll be double dosing this animal if my lock slips, as I'm involved in wrestling with them, getting this paste in their mouth. But clients are very familiar, particularly clients that are accustomed to worming their own horses. They're very familiar with this type of thing. And then, here's an example of an over-the-counter preparation that's supposed to be a natural calmative that, again, comes in a paste form. Non-calibrated syringe, but you just
You're
pull.
giving the whole dose there.
That's right, you're giving the whole dose. But you basically administer them the very same way that we're going to use with those catheter-tip syringes, going in the edge of the mouth, then centering it and squirting it in, as far back in the mouth as they will reasonably accept you doing.
So we've gone now having these commercially prepared things that are very convenient and sort of dose-related and so on. And some of the older equipment we used, for instance, you would have a dose syringe that would look more like this. About all that we use this for now is actually to rinse the mouth out when we're doing some procedure. But I don't give medication this way. It's not calibrated well enough, and it's awkward to use, and we just don't use it for dosing anymore. This is a balling gun, and this is another way of using, putting medication into their mouth. It would be used for putting a large pill of some sort in there, and we call them pill launchers. And you work that back into the back of their throat and launch the pill into that area. But gosh, it's kind of hard put to even think of any pills that are manufactured anymore for horses.
Sure.
That way.
Well, I think it's important to recognize the implement, but I can't imagine you'll be using it.
Right. So what happens now? You showed us the TMZ that dissolved up very, very nicely. But what happens when we have a pill or some medication that doesn't dissolve up well?
Well, I can think of 3 or 4 ways to do it. Mostly it involves figuring out a way to crush the pill. And you can have a mortar and pestle, just like that traditional pharmacist thing. There are some commercial pill crushers. One of the important things to remember is if you're going to be doing it twice a day, to start to set up your antibiotic for that 12 hours from now. When you give that morning dose, set up that afternoon dose and vice versa. And of course, you're going to laugh. What a lot of us do is, you get a little baggie, like a plastic bag, and you get your pills, and you get your Philadelphia screwdriver, and you crush the pills in sort of with what you can find around the barn.
Yep, that works.
Works.
Yeah, and you can crush them up ahead of time, put them in the dosage bags. If you're in a barn, like a boarding barn, where you're going to have somebody else give you the medication, you can get these things all set up.
Sure.
Yeah, so it works, and we find very inventive ways to get these medications dealt with.